Allergies affect millions of people worldwide, causing symptoms that range from sneezing and itchy eyes to serious reactions like difficulty breathing. But how do you know if you have an allergy? And what exactly are you allergic to? The key to finding answers often lies in a simple lab test called the allergy blood test. This test helps doctors discover whether your body is reacting to everyday substances like pollen, dust, certain foods, or even medications. If you've ever wondered why you break out in hives after eating peanuts, or why your nose gets stuffy each spring, understanding the allergy blood test can give you clarity and help you take control of your health. Imagine waking up with a runny nose, watery eyes, or a skin rash that just won't go away. These symptoms might seem minor, but for some, they can disrupt daily life. And sometimes, they can even be dangerous. That's where the allergy blood test comes in. It's a straightforward way for doctors to measure your body's response to possible allergens, the substances that trigger allergic reactions in certain people. By looking for specific antibodies in your blood, this test can pinpoint what's causing your symptoms and guide you toward the right treatment. So, what happens during an allergy blood test? The process is simple. A healthcare professional takes a small sample of your blood using a needle, usually from your arm. The sample is then sent to a lab, where scientists measure the amount of a special protein called immunoglobulin E, or IgE. This protein is made by your immune system whenever it thinks it needs to fight off a foreign substance, even if that substance is something harmless, like dust or pet hair. If your blood contains high levels of IgE, it's a sign that you might have an allergy. There are two main types of allergy blood tests. The first is called a total IgE test. This measures the overall amount of IgE in your blood. If your total IgE is high, it suggests you may have some kind of allergy, but it doesn't tell you exactly what you're allergic to. The second type is called a specific IgE test. This looks for IgE against a particular allergen, such as pollen, peanuts, or animal dander. If this test finds a high level of specific IgE, it means your body is reacting strongly to that substance. Why would your doctor order an allergy blood test? If you have symptoms like sneezing, coughing, itchy skin, or stomach problems after eating certain foods, your doctor might want to find out what's causing them. Sometimes, allergy blood tests are recommended for people who can't have skin tests, another common way to check for allergies, because of skin conditions, medications they're taking, or a risk of severe reactions. For young children, blood tests can be less uncomfortable than skin testing. Preparing for the allergy blood test is easy. In most cases, you don't need to do anything special. However, your doctor might ask you to stop taking certain medications, like antihistamines, before the test so the results are accurate. Always follow your doctor's instructions and tell them about any medicines you're taking. The risks of having an allergy blood test are very low. You might feel a small sting when the needle goes in, and there could be slight bruising at the spot where your blood was drawn. These symptoms usually go away quickly, and most people feel fine afterward. Once your results are ready, your doctor will help you understand what they mean. If you have a high total IgE, it's a clue that you might have an allergy, but you'll need more tests to find out what's causing it. If your specific IgE test shows a high result for a certain allergen, you'll know exactly what to avoid. The amount of IgE in your blood can't tell you how severe your allergy will be, but it does give valuable information for your care. If your test suggests you're at risk for serious reactions, like anaphylactic shock, which can be life-threatening, you'll need to be extra careful. Your doctor might recommend carrying an emergency treatment, such as an epinephrine auto-injector, and help you make a plan to avoid your triggers. It's important to know that allergy blood tests aren't perfect. Sometimes, the results say you have an allergy when you actually don't. This can happen if your body is reacting to something else, like a recent meal or even smoking. On the other hand, it's rare for the test to miss an allergy that you really do have. For the best results, your doctor may use both blood tests and skin tests, depending on your history and symptoms. Understanding your allergy blood test results can help you live a healthier, more comfortable life. If you have questions about your symptoms, your risks, or your treatment plan, talk to your healthcare provider. With the right information, you can take steps to avoid your triggers and protect your health. In summary, the allergy blood test is a safe and simple way to find out if you have allergies and what's causing them. By measuring special proteins in your blood, doctors can help you identify your triggers and choose the best treatment. Whether your allergies are mild or severe, getting tested is the first step toward feeling better and staying safe. If you experience symptoms like sneezing, itching, or trouble breathing, ask your doctor about allergy testing. Knowing your allergies can make all the difference in your daily life. Millions of people manage their allergies every day, and with the help of modern medical tests, you can too. The allergy blood test is a powerful tool that puts you in control of your health. If you suspect you have an allergy, don't wait. Talk to your doctor and find out if this test is right for you. With knowledge and support, you can live confidently, avoid your triggers, and enjoy life to the fullest.